Good, I'm a radiation oncologist.
Okay.
I know Dr. Yang right now is taking care of you on the surgery side, is that right?
Yeah.
So he wanted us to come and talk with you and just kind of get on board in terms of your care from the radiation side and see if there's anything that we could answer or talk to you about radiation in general. I know right now we're still trying to figure out exactly what it is that we're dealing with. But what I wanted to do was just introduce myself and see if I can answer any questions you might have.
Okay. I'm not real familiar with any of it.
Sure.
So, what's important to know about radiation?
So, a good question. You know, ultimately, when we talk about different processes and what we think your process looks like, it looks like just based on the MRIs that we're probably dealing with some type of a brain tumor. And in the setting of having brain tumors, we typically categorize the brain tumors in grades, and we decide the treatment strategy based on the grade. We can't tell the grade by imaging. We can kind of make educated guesses, but we really don't know exactly what it is we're dealing with unless we can take some tissue from where that tumor is, look at it under the microscope and say, okay, here's what we're dealing with, this is the process, and then we have kind of a typical guideline-based treatment strategy that we would use for management. In treatment of brain tumors, we use radiation commonly. We use surgery commonly, and sometimes we also use chemotherapy. And it all depends on what type of a brain tumor process we're dealing with. The goals generally from a management strategy standpoint typically involve doing surgery to the extent that it's safe, trying to get everything out that we can, but do it in the safest way possible, where we're, preserving all of your functions in the best way to try to leave us with a good outcome from that standpoint. And then based on the type of tumor process, very frequently we use radiation, especially in cases where we can't get everything out safely, or in cases where we might have a higher grade brain tumor and we're still able to get everything out, but we know that because of this process and the potential risk for recurrence without being, with it being what it is, we typically will add radiation afterwards. So radiation in general is an X-ray treatment. It's an outpatient treatment. It's a treatment that's given typically Monday through Friday. And in the cases of brain tumor management, typical treatment courses may take us about 6 weeks to complete. The treatment is painless. You don't feel anything from the radiation. And the goal is to get X-ray energy focused to where the tumor cells are, cause damage to those areas in a way that those cells cannot grow and divide and create more cells.
Create more cancer.
Exactly. And so we use radiation in that way where surgery is able to potentially get out a certain amount but might not be able to be safely utilized to get everything out, and then we focus the radiation on everything that we think would be at risk. So when we use radiation, our goal is to cover everything that we think is at risk but get the least amount of extra radiation to other healthy tissue.
Okay.
So typically when we look at doing radiation, it's usually well after we've been healed from a surgery, so maybe about 4 weeks out, and we would at that time know exactly what it is that we're dealing with. We would know exactly what the role for radiation would be, how many treatments we would do, whether or not chemotherapy would be recommended. We'd know the process that we were dealing with and likely what to expect from there. The radiation is planned using CT scans and MRIs, so we get a lot of those when we're thinking about radiation. The first step, if someone was to come to me and say, okay, I want to start radiation now because this is the process I'm dealing with, we do a very specialized CT scan in our department, which is down on the lower level of the hospital, and we make kind of like a tight-fitting mask around the head, so that when we're laying down on the CT scanner table, the mask kind of molds around the shape of the head, and we know that there's very little movement when we do the scan. And then we use that scan to map out, based on that person's anatomy and the area that we want to target, how to get the radiation there the best. We can use the MRI and put those together and really help kind of shape the treatment area to the most ideal scenario. And then it takes us about a week to generate a treatment plan using the CT and the MRI studies. When we figure out the safest approach to treating everything we want to treat and then we would start the treatment process, and then it's generally a daily treatment, Monday through Friday, and each treatment takes about 15 minutes.
Are the treatments something that I can get myself to and from? Or would I need someone to drive me?
Yeah, so that's a great question. Typically, I would say in this process, most people would have someone drive them, but a lot of it really depends on how we're feeling and how everything, as far as your
The
recovery went after surgery.
What
Exactly.
extenuating possible side effects or damage?
Mhm. The treatment itself, like I said, they're pretty quick treatments, so people can be in and out of our department in about a half an hour each day. And then my
And
patient,
would they be here at Bergen
correct.
or, okay.
Yep, so we treat here at Bergen, down in the lower level. And, the treatments themselves, when the radiation's delivered at the treatment machine, it's only present at the time of treatment. So when the patient gets up off the treatment table and goes home, goes back to anything they're gonna do that day, there's no radiation left in their body, so there's no radiation exposure risks.
Okay.
The treatment itself, as I was saying, it's a painless treatment, it's all X-ray energy. And I know you've had CT scans and X-rays before in the past, and so, it's in the same way, you don't feel anything from that X-ray energy. But as more treatments deliver, we can have some fatigue, we can have some hair loss, we can have sometimes a little bit of nausea, and sometimes the short-term memory can be affected, particularly in the area that we're considering treatment for. And so that short-term memory, it wouldn't affect long-term memories, but in the short term, sometimes things can be a lot more challenging in terms of just kind of, small things that you do on a daily basis may take a little bit more concentration. Does that all make sense?
Yeah.
Okay. I know it's kind of hard to even know what to ask sometimes when we don't know with 100% certainty what it is that we're dealing with. So my goals are really just to try to kind of give you maybe a little bit of a picture of what that might look like. And then when we get closer to potentially knowing, what things might look like from a treatment standpoint, we can sit down and kind of go through all these things again. We'll look at, after you've had surgery and see what exactly it is that we were dealing with and say, okay, here's the process that we had, here's what's generally recommended.
Does the radiation affect the skin,
Where we're treating, like in the head?
Yeah.
So it affects it in a way that we can get hair loss, and typically that may grow back, but it may take a while, and it might not be just general hair loss. It could just be in several focal areas, and it all kind of depends on what the treatment plan called for. And so we try to figure that out at the time of treatment, but that can happen.
They say too that it's almost like a burn.
You mean the radiation, on the skin? So in some cases, when people are having treatments to areas of the body that are very close to the skin, in those cases the skin can get a lot of X-ray radiation dose, and you can have some skin changes that look like almost like a sunburn. In the setting of treating something that's deeper than the skin, the dose to the skin is actually much lower. So I don't worry about skin irritations as much, aside from that scalp radiation dose can affect the hair.
Okay. It goes back. I'm not so vain or worried about the hair.
No, I know, but it's nice to know kind of what sort of things we might deal with, and just to kind of, and I'm an open book, I won't hold anything back. I like to be able to have very reasonable expectations, and I think that's only fair to you.
Sometimes it may not fall out right away.
Correct.
You may want to get it cut shorter because it's easier to take care of and it's not bothering you. My sister-in-law, Rita, she decided just to get a boy haircut.
I kind of feel like that's about what I got already, so.
Yeah.
Do you have any other questions I can help out with? It's okay if you don't.
I really can't think of any off the top of my head. It's just, this is all new, and it's like,
Just a whirlwind of information and
Will it make the treatments possibly affect the taste and stuff of food that you eat then?
I wouldn't
don't
expect a
know.
major change in
Oh,
taste. So,
okay.
so the
I mean-
effects of, no, these are good questions
I
because
don't know, I just.
No, you're asking good questions. The reason I think it's a good question is that in a lot of people, just like the skin irritation, the effects of the radiation are really dependent on the area that we're treating. And so some people being, I have patients that get treated for processes that are involving the neck, and in those cases, because of where the area that we need to focus on, the skin gets a significant amount of radiation dose, and so do the glands that make the saliva and that are important for our taste. And so that can certainly be impacted in those cases, but I wouldn't expect it to be a consideration in yours.
and
So this all presented with dizziness, is that right?
well, basically, I've had problems with my equilibrium in the past
Mm-hmm.
and with vertigo.
Mm-hmm.
And so I was feeling a little dizzy, and then I had a doctor's appointment scheduled for Friday, and was just kind of gonna wait and see him and see if, if my vertigo had come back or what. And then, the kids have told me, Mom, and I've been kind of unsteady, I've fallen a few times, and then Saturday morning my youngest daughter came over and said, Mom, we've been worried about you. She says, I think we need to go to the ER. You look like you had a stroke. Your left side of your mouth's drooping. So that's what brought us
That prompted
in,
everything. Okay.
and that's what prompted the scans. But I've kind of, felt a little dizzy for the last couple of weeks.
And a headache.
And a headache, yeah.
And we noticed some confusion and memory things.
Okay.
Yeah.
But just
That's
of the
why they
very
were worried.
recent past, right?
I want to be honest and say that I had some thoughts around mid-May
Okay.
that Mom wasn't as sharp as she used to be. I attributed it to old age,
Yeah, and
getting older. Getting
of
older,
thought,
yeah.
Hey, am I getting old timers?
She said
Am I
she was
getting
forgetting some
all-
things.
Alzheimer's,
Yeah.
or dementia, or
Yeah.
whatever,
Yeah, it's hard to know sometimes when
And
you're just
so-
like, it's very subtle, not enough to be super alarmed, but
right.
at the same time you feel like something's not just 100%.
Right.
Yeah.
Well, we'll just take it a step at a time. As I know anything on my part that will change, what our direction is, I'll certainly share it with you. Dr. Yang and I share a lot of patients, and I think he's very skilled and very knowledgeable, and I have a lot of trust in his skills, and I think he'll be in good hands. We just gotta take it a step at a time and make sure that, everything's lined up for the best chance of success. And then, once we know exactly what we're dealing with, then we can say, okay, here's the kind of the anticipated game plan for the next steps, and we kind of go from there.
Will they give it a stage then, once they operate? Is that how they go
So,
about that?
interesting in that, so what we typically with brain tumors, we don't so much stage them as we do tumors in other areas of the body. And that's only because most brain tumors don't really go anywhere else, most of them. They're really just confined to the brain, but we give them grades.
Hey, buddy.
And those grades are kind of similar to staging.
Okay, give me a
The
few
grade
minutes
kind
and,
of paints the
we're
picture
gonna
and
go
tells
through
us,
the
okay,
document
here's
and
what
I'll
likely the
come over
outcome
and get you
of this
something, okay?
process may be, what kind of to expect.
Right.
We can know
Actually,
by
hey,
dealing, once we have the information that tells us the grade
Is there corn dogs or pizza
and
rolls that you can
specific
warm up?
proteins that might be present, that will tell us what our treatment strategy should be, what the potential prognosis would be, and kind of what ultimately the next steps should be.
Okay, but
And we have that all from just clinical trials that have been done, and they're constantly ongoing, that have shown, okay, in this setting, this is the best step for management. In this setting, here's the best step for management. And sometimes we have clinical trials available that may allow us to do additional things as far as medications and and different treatments that might not yet be standard of care.
Okay,
It all
well,
kind of
we're
depends
not
on what you
corn
feel
dogs for
comfortable
right
doing.
now.
But we can
There
look
should
at
be plenty
those
of corn
things
dogs
when
that
we
you
get
can
there.
warm up. Okay,
Does that all make sense?
Yeah.
Any other questions? I can
2
answer?
minutes.
Not that I can think
Alright,
of.
love you.
Anything you guys can think of?
Okay.
Oh, we've had
A lot.
I had a
Whirlwind
list that
week.
has pretty much been answered. I think one of them was how do you determine what kind of cancer it is without doing a biopsy?
So that's a great question. You typically can't with 100% certainty.
Right.
You can make guesses. You can say, okay, well, if there's no enhancement of contrast, maybe we might be dealing with a lower grade process. If we
Okay.
see more contrast enhancement, maybe it's more higher grade. If we see swelling, maybe that portends that it's more high grade. But we can't say for certain until we take it underneath the microscope and look at it and say, okay, what do these cells look like? And so typically, we don't like to make treatment-related decisions until we know exactly what we're dealing with. And this first step, generally, for most patients that are good candidates for surgery, is surgery to try and maximally remove everything that's potentially there causing problems.
So when they do remove the tumor, as much as they can, they will know within a day or so, or within,
They may have
Reasonable.
some information within a day.
Yeah.
So they do, sometimes at the time of surgery, they can have the pathologist look at the cells under the scope and say, this is what I think I'm seeing.
yeah,
But the definitive
that they go through the
diagnosis,
lab.
may take 1 week to
Okay.
several weeks.
Okay,
And the reason is that there are different tests that can be done in a very short period of time, and other tests that really require sometimes even a couple weeks that they'll
Age.
send out.
right, yeah.
And so all those
Petri dish growing.
Yeah.
all those tests help us to know, okay, here's what we're dealing with, here's what the treatment strategy is likely to be because of the grade or because of the cells or because of the proteins or the mutations on the cells themselves. All those really guide us.
Reach out to Rebecca.
What?
Reach out to Rebecca.
Yeah,
Becca Bird.
yeah, I know what you're talking about.
What'd she say?
She asked Courtney to reach out to one of their friends, a family friend.
Oh,
Family friend, Rebecca.
oh,
She befriended the kids when
When we used to go to the
we
pool.
they used to go to the pool all the time. And she is, she's
She's a med tech.
She's a med tech and pretty high up in, she was in the army.
Military.
She was a major in the army, and she's not in the army anymore, but she lives down, in Alabama,
Arkansas.
Arkansas, and she's pretty high up in around. She's like pretty high up. She's a good person to
yeah.
ask questions of.
Sure. It's good to have good resources, friends and family support. So right now, are you having headaches or dizziness?
No.
Blurry vision, double vision?
No.
Strength the same on both sides?
Yes.
And as far as the legs and the arms, everything functioning the way?
Everything's functioning.
And the balance, did it get better? Did it change?
It's been better, and I think part of that might be the steroids
Yeah.
helping maybe shrink a little bit.
Yeah, it could be that it addressed the swelling pretty quick.
Yeah. Like yesterday I sneezed and got a headache. I sneezed earlier today, but I didn't get one.
'Cause I don't see the facial droops
It's
so much. I mean, you have those-
improved a lot,
Immensely.
Yeah.
immensely. And
So-
Yes.
I can tell a difference in movement, balance,
Good.
strength,
Very good.
Beach, everything.
everything. Yeah, everything. I can tell a
noticed
difference.
your one eye, that is, the pupil is bigger in one than the other. I don't know if it's still that way
They
today.
said
Yeah,
that
the nurse
left-
said that. Yeah,
They said my left eye is
slower.
slower responsive than
Yeah.
the right.
And see, I noticed that right away when I talked to you. I didn't say anything, but I thought, I wonder why that pupil is so big. That explains it. That's, at least you can still see.
Yeah.
You know, so.
Well, any other questions right now that I can help out with?
Not that I can think of.
So I'm available if there's anything that I can help with. Right now, I think that everything is gonna be between, you know, you guys and Dr. Yang's team to move forward with the next steps, and then, we'll look to kind of regrouping when we have more information and kind of go forward from there.
Get a plan, get a game plan. Said I wanna kick cancer's ass. I've been kicking around retirement thoughts here for a little while.
She's ready to get the hell
Uh,
out of here.
You know, it was
Out
like,
of Dodge it.
need medical to retire, you know, and so I just turned 64. So I was figuring I was gonna probably have to work till 65.
What kind of work do you do?
I work in an office and work on a computer all day long.
Okay. Well, if I have something new on my side, I'll certainly share it with you.
Okay.
Otherwise, we'll look to kind of seeing how things go with time. Anyone else have any questions I can answer for you right now?
She'll be able to return to work, do you think?
I honestly don't know.
I mean, we'll know after surgery.
Yeah, I think once we know what we're dealing with, and we can kind of figure out.
The
Well,
paperwork they filled out, they told me I'm not going back for 6 months.
Well, and so the
Wasn't
memory
it
and
6
stuff
months?
too, so
At least 6 months.
you never know. I just was,
Come
that was
on
a
in.
question.
With food service.
Come on in.
Yeah,
Got some dinner for you. Do you want me to put the table over here right now, or just leave it on the side?
Thank you.
you're welcome. You guys take care.
Over-
Thank you, doctor.
Thank you, doctor.
Sorry, I didn't mean to interrupt.
No, you're fine.